Welcome back, everyone. We're really having a good time learning some very important tips for how you can master your mind. So important. We're here with Dr. Stephen Hayes, author of Liberated Mind, professor of psychology, teacher. He and I both teach together at the Evolution of Psychotherapy conference coming up in December. It's going to be a virtual conference given what's happening with the world. So you don't even have to get in your car and drive to Anaheim. You can get Stephen's wisdom virtually. Evolution of Psychotherapy. I don't know how many lectures you're doing, Stephen. I'm doing 6.
Yeah, about that range. Too much.
Craziness. And we've been talking about ACT, acceptance, love that word, and commitment therapy. So let's talk about it for people who have anxiety disorders, whether it's generalized anxiety or panic disorders, where you started.
Yes.
Give us, if you could, some examples of maybe people you've worked with and then the process of getting well.
Well, the previous segments walk through some of the parts that are more over on the acceptance and mindfulness side. And so they probably feel a little familiar. We haven't talked too much about connecting with a sense of self that watches and observes all of it. And I really want that because it looks to you when you buy into this narrative self-story, which takes over parts of the mind in such a way. We're seeing it in the psychedelic therapy that we're doing. ACT is used very often in psychedelic therapy, that it starts opening up sensory motor channels that have been inhibited by the narrative sense of self, so that you literally don't contact things that don't fit your self-story. It's harnessing parts of the brain that are ancient, that are with these new tools. But so we want a sense of self there that is more spiritual, I might say, less defined by form and more by pure awareness. The kind that is there, that starts in this journey we're on when your mama looks in your eyes and says, "Oh, you sweet baby," and you dump natural opiates in your brain just at the process of being seen. Because we're such social primates, it's critical. And by the way, mama's brain is doing the same thing. And the only other creature that does it is dogs, and we've been co-evolving for a pretty long time. So we're connected in consciousness, and we want to open up to that part. And so we try to do things that separate the content from the observer, the noticer, the witness, the I hear nowness. So that when you have anxiety, when you have your body doing what you're doing, you have your mind telling you have to run, you have to fight, you have to hide, you can notice that and have a little bit of separation that's not dissociative, but more perspective taking. You can see it happening, learn from it, find out what's inside it. So that's one thing I would do, that I need to take the next step to what's inside your anxiety struggles. And I'll give you a practical example of that. But yeah.
That's so interesting. As a child, I grew up with a lot of chaos, and I just actually wrote a book about it. It's called The Relentless Courage of a Scared Child. And it's really about overcoming trauma, chaos, grief, that kind of stuff in your earlier years. One of the things someone taught me, and I don't even remember who taught me this when I was going through something really hard, but it sounds a little like what you're describing, and it really helped me. So I finally learned how to settle my monkey mind by, learning how to meditate, which was not an easy thing for me. But someone taught me that if I could elevate, like imagine myself elevating out of the scenario and look at it from a 30,000 foot view.
Yes.
And watch it like a movie, but not be in the movie. And then what would the characters do? Like, what would you have them do? What are they doing?
Exactly.
How does it work out? It was mind blowing to me. It was such a simple thing, but I was like, wow, like it really helped me.
Well,
is that kind of what we're talking about?
Yeah, absolutely. It's powerful in the model. There's a number of techniques in the ACT work, and it's even in the basic science. I think I can explain a little bit in terms of our theory of cognition and the actual work that's being done. Dozens of studies that make sense of what you just said. And by the way, I had the same experience. What I found inside my panic as I moved through was a scared kid under the bed listening to my parents fight. With my dad as an alcoholic, my mom kind of depressed OCD, and with domestic violence. And I was afraid he was going to hit her. And sometimes that happened, or threats of it, very strong threats of it. So, it activated very primitive programming, because my first panic attack happened in a psychology department meeting where I say full professors were fighting in the way that only wild animals and full professors are capable of. Which is why I did not know where that emotional arousal came from, because I had suppressed that memory so much that I didn't have easy access to it. I could have said, "Now my parents fought," but I didn't know that it. So if we take this witnessing self, what you just said, and the example you use of perspective taking, here's this, makes tools very simple if you understand the cognitive basis of it. There's three relations that are learned in young children: I, you, here, there, now, then. They're learned in that order. When they come together as I, here, now, you're able to extend consciousness verbally to you, there, then. We could imagine what it's like right now to be in the wildfires in a particular state, or starving, or in a war zone in another part of the world. What's going to happen in the future with our children? So when you shift time, place, or person in terms of perspective taking, you're tapping into what your contemplative practice is giving you. As if you're doing follow the breath, for example, your attention takes it away, you catch the puppy moves, you connect with this I, here, nowness, and you bring it back. There's a part of your mind that isn't on autopilot, that isn't programmed in that way. It's just here, now. And you keep touching that part and then bring your attention back to the present. Well, if I asked you, for example, go back to the question that you asked, Daniel, what to do about an anxiety kind of thing. I'll take my anxiety, which has to do with social anxiety and panic. What I'm going to want to do is catch this witnessing self and look with a sense of self-compassion, self-kindness, acceptance, in the sense of receiving the gift of what my mind and body is doing. As I do that, I open myself up to the history. I tell the story in one of my TEDx talks of actually finding the little boy under the bed who I didn't know was there at 8 years old, crying and saying something. I'm going to do something. And then realizing there was nothing safe to do, and backing up and just holding himself and crying more. I'm a grown-up now. I'm a psychologist. I can do something. No, I couldn't solve my parents' problems, but I can walk into the hell of other people's history and help them solve theirs. And so part of the shift here is inside your anxiety struggles, inside your self-criticism, is a deep yearning for something that is values-based, which, if you get this more transcendent sense of self in the room, you're not threatened by your history, and so you can learn from it. I didn't find this out about the values underneath my panic disorder till 3 years into ACT. I had to sort of really convince my mind that it's okay to be me, not by argument, by experience. And then it started opening up the doors to my history, and I found things out. And what I found in there was that why I'm a psychologist, I found meaning and purpose. I've never met a social anxiety person who doesn't want to be with people.
Right.
You? I've never met a depressed person who doesn't want to know how to feel.
Right.
And participate and be part of it. So underneath our pain is our purpose.
Right.
You flip it over.
Talk about pain to purpose.
Yeah. And I actually titled my first TEDx that I said, how to turn pain into purpose, because that was what happened to me in my panic struggle.
Interesting. Fascinating.
And I would want to do that with anxiety person. I would, use this kind of witnessing self, this acceptance and diffusion techniques, then go into the panic, but not as an end result with a secret message of when you diminish it enough, you can live. No, more like this is a passenger that will come along with you in your journey and that has important things to tell you.
I love that.
Like, for example, that suffering matters in my own history. Yeah. And you really want to do something about it. Well, that gets me up in the morning.
Yeah.
I love that. All right. When we come back, we're going to have one more session. I think we're getting our own therapy.
I know. I have so many questions. This is so great.
We're going to talk about ACT and depression, which has tripled since the pandemic started. It's just horrifying. We're here with Dr. Stephen Hayes, author of Liberated Mind, professor of psychology. You can learn more about that either by getting a copy of Liberated Mind or going to Stephen's website, Stephen with a V, Hayes.com. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.